Alright guys, this is going to be a quick video on some lip anatomy and some of the superficial landmarks that you can use to describe to someone what you're looking at. So we'll start off, obviously this is superior lip, here's the inferior lip, this is the cutaneous lip because that's the actual just normal skin of the face. And when the point where it transitions into the actual vermilion, and vermilion just means red because obviously this is a red lip, transition from the cutaneous lip to the vermilion is called the vermilion border. Plastic surgery will get called a lot, or ENT, when lacerations cross the vermilion border. Right next to the vermilion border is a very important structure that basically defines the projection of the upper part of the transition zone at the vermilion, which is called the white roll. And this is just a projecting part of the muscle that is around the mouth, which is the orbicularis oris. The pars marginalis, which is the part that creates the white roll, is the very subtle white roll that you can see if you really look at someone's lip. It's very important to recreate that when fixing lacerations. So what's the difference between the vermilion that's dry and wet? Well, the wet vermilion, which is here, is basically an extension of the intraoral mucosa. It's rich in, its submucosal layer is very rich in minor salivary glands. Basically, it's the wet part of the lip. And the transition here to the dry vermilion, this is the part that gets chapped, and you have to use chapstick. This is because there's no salivary glands here. It's very, very thin epithelial cells that are basically covering the capillaries, which is why this part's red as opposed to the cutaneous lip, which is not red. The capillaries are basically small, tiny little branches of the superior labial artery. The inferior labial artery supplies the lower lip, while the superior labial artery supplies the upper lip. These are all coming off of the facial. The facial is coursing here, and then as it gives off the superior labial, inferior labial, and then it continues to the angular artery, which you can see it makes this kind of angle and continues this way towards the nose. Coming off the superior labial artery, there's a columellar branch that goes up to contribute to the blood supply of the columella, which is the base of the nose, that a lot of people that may not do facial surgery will call the base of the septum or something similar to that. The filtral columns are basically these fusion lines where the intermaxillary segment in embryological development comes down to form this the central part of the upper lip. And this is basically also decussation of the orbicularis oris fibers that kind of contribute to the prominence of these filtral columns. In between the two is the central depression, which is sometimes called the filtral dimple. Now, some important terms that are used when you're using facial fillers or any other dermal filler are the nasolabial fold, which you can see here is the commissure where the superior and inferior lip kind of come to a point. Extending superiorly towards the base of the nose is the nasolabial fold. Makes sense, right? From the labia part to the nose is the nasolabial fold. On the other side, going inferiorly, sometimes called marionette lines, because of those creepy puppets that you could move their mouths, ventriloquists use, you could see that there's lines extending from the commissure down towards the chin. More specifically, these are called labiomental creases because they go from the labium to the mentum, or the chin. Here you have a mental crease, which is a transverse depression that you can see here, inferior to the inferior lip. Some other important structures, here's Cupid's bow. Here are the peaks, one peak and two peaks. This is the nadir, or the lower part, the trough. All right, guys.